Good afternoon. It's my pleasure to present our previous research work in the International Research Awards on Cardiology and Cardiovascular Medicine conferences and the category of our Best Research Awards. I'm Professor Xiaohua Li, and I come from the 4th Military Medical University, Xijing Hospital, which also named the Air Force Military Medical University. The topic I want to present is a retrospective study of the role of preoperative ultrasonography in the detection of deep vein thrombosis in 1,750 patients with gastric and colorectal cancers. My presentation contains the several directory. The first is the background of the research. The second is the design, and the third is the results of our research, and the fourth is the next work plan. First, we want to show the background of this research. We know the digestive tract tumor is a major disease affecting human health, especially in East Asian countries such as Japan, Korea, and China. In our country, the digestive tract tumor, the morbidity and mortality rank in the top 7 of all malignant tumors. From the following two figures, we can see that the incidence and mortality is very high in all malignant tumors. And we know that the surgery is the first choice for the treatment of those tumors. In our clinical practice, we find some phenomena. We found that the patients with the digestive tract tumors who are surgically treated often experience unexpected death during the perioperative periods due to venous thrombus embolism. So we want to know what is VTE. The VTE is a disease in which abnormal blood condenses in the venous cavity. So it forming emboli and causing venous blockage, which leads to blood circulation disorder. Especially, it mainly includes deep vein thrombosis and pulmonary embolus. So, we want to see the PE is one of the life-threatening complications of digestive tract tumor surgery. It usually occurs when a portion of DVT in the lower extremities breaks off and enters the pulmonary circulation, that is, pulmonary thromboembolism occurs. In the first minute after the occurrence of PE, the patient's mortality rate was close to 10%. So, it was very important in our clinical practice. Screening and prevention are the key means to prevent this disease. In 2020, The Ohashi published their research work in the Journal of Clinical Oncology. They showed that in a multicenter baseline data, they found that tumor patient VTE there was 1,571 patients with VTE, and the non-symptomatic VTE patients accounted for 94.57%, and the symptoms of VTE patients were 5.43%. The screening of patients of DVT in the lower limb of the patients with early treatment of the lower extremities was critical to the detection of asymptomatic VTE patients. So, we want to see the relevant research abroad. In April 2020, Altea published their research work in the Blood Advances. They began to examine the normal surgical treatment of the lower limb venous ultrasonography as a regular inspection of the patients with the digestive tract tumor surgery. They want to determine whether there was DVT during the preoperative operation, and if the lower extremities intravenous ultrasound was positive. The several steps need to performance. One is the heparin anticoagulant. The second is grounded pressurized elastic socks. And the third is inferior vein filter. And the fourth is the intermittent pressure therapy. If the lower limb venous ultrasonography was negative, they recommend that the grounded pressurized elastic socks or intermittent pressure therapy need to performance. So, the American Society of Clinical Oncology and Clinical Practice recommend the above steps. The second part, we want to introduce the design of our research. Our research was a retrospective study. The subject of our research wants to reveal the anatomical distribution, prevalence, and risk factors associated with lower limb DVT in 1,750 patients with preoperative gastric and colorectal cancers, and to evaluate the role of preoperative ultrasonography in the detection of DVT in preventing postoperative pulmonary thromboembolism in patients with gastric and colorectal cancers. The methods was that a total of 1,750 patients with gastric and colorectal cancers who underwent preoperative venous ultrasonography of the lower limbs were respectively reviewed. The risk factors associated with preoperative DVT were identified using the univariate and multivariate logistic regression analysis. Then we want to see the inclusion criteria of our research. The first is the all ages of the men and women. The second is that the pathological examination is clearly diagnosed as primary or secondary gastrointestinal tumors. The third, that the tumor patients with surgical treatment in our department. And the fourth is the integrity of clinical data, includes the medical records, inspection, and inspection results, and so on. Which is the exclusion criteria. We can see that if the patients without the gastrointestinal tumors, except for stomach cancer and colorectal cancer, and the patients who were not treated in our department, or the patient's information is incomplete or excluded. The technical route in this research is that we first organize all clinical data of the patients for this study. Then, the registration of clinical baseline materials such as age, gender, BMI, and drink history, and so on, were recorded and collected. Then, we statistically analysis of the above clinical risk factors. The statistical analysis was performed using SPSS software 26. The chi-square test or Fisher's exact test was used to compare the frequencies of the categorical parameters. Multivariate analysis was performed using binary logistic regression analysis, and p-value less than 0.05 was considered as statistically significant. Since the dependent variable is a binary variable, we used binomial logistic regression in this research. In the part 3, we want to show a results of our research. This is retrospective study was conducted by reviewing the data of preoperative venous ultrasonography of the lower limbs from 1,750 patients with gastric and colorectal cancers in our department. These patients included 1,184 men and 566 women aged 20 to 92 years, with a median age of 61 years. We obtained the parents' clinical pathological data by reviewing their medical records. The tumors were described and the resected specimens were evaluated histologically according to the UICC classification. The performance status of each patient was evaluated according to the scale of the Eastern Cooperative Oncology Group. The ASA physical classification score were assessed using the scale of the American Society of Anesthesiologists Physical Status Classification Scale, and the patient characteristics are shown in the table 1. Among the 1,750 patients, we can see that 73 patients had DVT indicated by preoperative venous ultrasonography of the lower limb. And the table 2 shows the anatomical distribution of DVT in 73 patients who were diagnosed with gastric and colorectal cancers complicated by DVT. Of the 73 patients, only 10 patients were diagnosed with chronic DVT by preoperative venous ultrasonography of the lower limb. The results showed that the soleal vein was the most common site of DVT, and the peroneal vein was the second most common site of DVT, followed by the superficial femoral vein and posterior tibial vein. Then we used the univariate analysis was conducted on the correlation between the occurrence of DVT and the clinical factors. Univariate analysis showed a high risk of DVT in patients who meet the following criteria, such as the aged, more than and equal to 18 years, female sex, and the PS value more than or equal to 1, and the stage 4, the ACE class more than or equal to 3 or 4, and hypertension were the high-risk factors correlated with the DVT. The multivariate logistic regression analysis showed that the female sex, stage 4, and ACE class more than or equal to 3 and 4 were significantly associated with DVT before gastric and colorectal cancer surgery. The results are shown in the table 4. The incidence in patients without risk factors significantly associated with DVT was 1.95. The incidence in patients in the presence of 1, 2, or 3 risk factors significantly associated with DVT was 5.51, 10.27, and 16.67, respectively. According to the American Society of Immunology 2020 guidelines for management of venous thromboembolism, we took preventive measures for 73 asymptomatic DVT patients, including lower molecular weight heparin, grounded compression stockings (GCS), inferior vena cava filter (IVCF), and intermittent pneumatic compression (IPC). 57 patients received low molecular weight heparin, and 16 patients received inferior vena cava filter plus low molecular weight heparin. A total of 1,677 patients who didn't have DVT received graded compression stockings plus intermittent pneumatic compression. Therefore, we need to highly consider patients with DVT and take timely targeted preventive measures for pending surgical cases. From the above results, we can see that the innovation of our research has 3 points. The first is the incidence and anatomical distribution and influence factors of the lower limb DVT were firstly reported. The second is we established a system of screening management for lower extremities, further improved the recovery system, and all patients were not diagnosed with a pulmonary embolism. The third is to provide the guidance for the establishment of the DVT screening management system of the lower limb of the digestive tract tumor in the hospitals at all levels. And our above research work was published in the thrombosis research and have an impact factor of 10.407. The part 4, we want to see what we want to do in the future. Here, we can see that we want to prospectively collect the digestive tract tumor patients, recorded the baseline date and the incidence of DVT before and after the operation. The third, the effectiveness and accuracy of the ultrasonic examination and D-dimer will be compared. If possible, we want to construction of risk assessment model for venous thromboembolism after digestive tract cancer surgery. We hope we want to prevent the DVT during the operation period. This is my presentation. And this building is our school. We hope we can see you in the future in Xi'an, China. Thank you. That's all.